Hi, I'm Subhashini. Today I would like to present about professionalism in nursing practice. The code will be NBBS 3204. So the title will be Enhancing Trust, Teamwork and Patient Outcomes. So, what is professionalism in nursing? So, the definition is professionalism in nursing refer to the values, behaviors, and attitude that reflects a commitment to high standard of care. So, core attributes is ethical conduct, accountability, integrity, respect, and continuous learning. So, another way we can say is a professionalism in nursing practice is a demonstration of values, behaviors, and attitude that reflects a nurse commitment to delivering safe, ethical, and high quality care to the patient. It encompasses every interaction with patient, colleagues, and the community. So, the key element of professionalism in nursing, there are a few key elements. The first one is ethical practice, upholding patient rights, confidentiality, honest and integrity. The second one is accountability, taking responsibility for action and decision. The third one, competence, maintaining and improve clinical skills and judgmental. The fourth one will be respect and compassion, providing dignified, empathetic, and culturally sensitive care. The fifth one is effective communication, clear and respectful. So it will be build trust with the patients and family, ensure safe ethical care, strengthen interdisciplinary teamwork, promotes effective communications, support evidence-based decision making. Example would be a nurse who communicate respectfully and listen to the patient concerns will build rapport leading to improve enhance to the treatment. So, these are the key element, important key element in nurse-patient communication. As I said, respectful language and empathy, confidentiality and honesty, active listening to the patient needs, such as a nurse reassures a patient feeling anxious before surgery by explaining procedure with calm and answering questions sincerely from the heart, so the patient have a comfortable and they know what the nurses are going to do next, so the patient will give more cooperation to the nurses. Professionalism in teamwork. So, collaborative care with the doctors, physiotherapists, pharmacists, as well as the nurses and the colleagues. So, the accountability will be shared in the task. So, each nurses or team members or working colleagues will share equal tasks. Supportive behavior to the team members. Each of the members must be support each others. So the procedure will carry out with a safe and most important patients are safe. Example, during a code blue situation, the nurses remain calm, follow protocols and clearly communicate with the emergency team. So each and every nurses will play an important role during the code blue situations. The patient safety will come first before they are doing something. Professionalism in clinical decision making. So, integrating clinical knowledge, patient values, and ethical reasoning, using a critical thinking during a high pressure decisions. So, the nurses must have a critical thinking and then have to know what decision to take and make sure the patient safety comes first. So, respecting patient autonomy, a patient's thinking, thoughts, and decisions. So, a nurse advocates for a patient refusing a blood transfusion due to the religious belief. Ensure alternative are explored. So, the nurses should know what are alternative way to ensure the HB of the patient increase, or how to do a blood transfusion and how to convince the patient. Scenario 1, challenge to the professionalism. So, A nurse disclose a patient conditions to a friend without any consent. So even though they are best friend to you, you should not share any patient details because it's a PDPA and it's under policy. If the patient get knows, patient can sue the nurses. So the issue identified: breach of confidentiality. So confidential things we really break down. So violation of the ethical code. So these are the things that patient can shoot to you. The solutions is re-educate on patient privacy policy to all the nurses. So all the nurses must read through all the policies regarding the patient's right. Encourage ethical reflection and accountability. Report breach to the nursing supervisor. So the nursing supervisor will play a main role how to educate their staff. So make sure the patient's information not be shared. Scenario 2: challenge to the professionalism. A nurse speak brutally to a junior colleagues during a busy shift. So issue identified there is poor communication, undermines teamwork and morale. So these nurse don't have a good attitude and good example to the junior. The senior don't know how to treat the how to guide the junior colleagues. The solution will be provide feedback using a respectful, non-judgmental approach. Promote emotional intelligence and stress management. Foster a supportive team culture. So we all the nurses have to go through all the stress management. They have to know how to manage the stress level during a busy shift, and we have to teach them how to give a supportive to a junior who is freshy, and we have to teach them how to go through the stress management level. Applying ethical principle and critical thinking. Autonomy, respect patient right, beneficence, promote well-being, non-malfeasance, do not harm, justice, treat fairly. So everyone is the same. Use a critical thinking to reflect on personal bias, evaluate, evaluate consequence of actions, make balanced and ethical decisions. Strategies to maintain professionalism. Engage in continuous professionals development, that is CPD points to all the nurses. They have to renew every year as per MOH rules. So participate in mentorship program. All the nurses must go through mentor mentee program. So the mentor will teach how to uh, do a critical thinking, stress management level, nurse patients relationship to all the juniors. Follow professionalism, code of ethics, example ICN, NB, and NBA. In some of the hospital, we call it as on-brand training to train the nurse how to behave. Use reflective practice to improve the performance. Okay, as a conclusion, professionalism is a foundation of good quality care. It influences communications, teamwork, and clinical decisions. Challenge required ethical reasoning and critical thinking, and maintaining professionalism to improve trust, safety, and patients' outcome will be so better. Thank you so much. These are the references. Thank you.